Good morning, everybody. My name's Mark Howard. I'm Director of the British Council here in Spain, and I just wanted to say welcome to the Teaching for Success Conference 2020. As it's a conference for English teachers, I thought I should really cover the main tenses in English. So I want to talk about the future, the past, and the present. The future, the theme of this conference is very much about the future. It's future-proof learning. How do we do that? I suppose it couldn't be anything else this year. It's been a really challenging year. It's been a difficult year for many people, I know. But at the same time, I think that's given us opportunities to learn, opportunities to develop new skills. And that's really the focus of the conference this year. How do we learn from that? And how do we begin to change, develop, and future-proof learning for ourselves and for our students? There's lots of sessions, really interesting sessions from a range of speakers, which will cover how we can do that and the things we've learned, particularly over the last few months, but also before. And some of it's about accelerating some of those changes that have been happening anyway. So that's the future. The past, always important, really important for us this year at the British Council. We're celebrating our 80th anniversary as the British Council here in Spain. 80 years of building connections, understanding and trust between the people of the UK and the people of Spain. Our theme this year is, thanks for helping us grow by your side. And it is about thanks. It's important to work together. And a key part of our work is people to people in the UK and in Spain. And in this case, working with teachers. We've always worked with teachers over the years, and it's a real privilege to have learnt and worked alongside many of you and your colleagues previously. So thank you for allowing us to do that. A couple of things to celebrate the 80th in this conference. In the virtual hall, you'll be able to leave a teaching tip. And the idea is we'd love to get to 80 teaching tips that we can then pull together and share with all of you. So please, if you can, leave a tip for the rest of us. And we'd also like to do a small competition where you can nominate a colleague whose dedication to teaching should be celebrated. And we'd like you to see if you can do that in 80 words, a kind of a mini tweet. And then at the end, we'll have a look at those, choose some winners, and we've got some prizes of courses and other things which can be helpful. And so the present, here we are in the present. We should live in the present. Here we are at the conference, and thank you for joining us this morning. We've got one of the advantages about online, as you all know now, is we can have people from across Spain, and we've got really a nice people from across Spain joining us simultaneously now. It also means that we can bring in one of our plenary speakers from Mexico. So we'll be joined by Graham Stanley at 12:30. I'll be introducing Graham then. And Graham's going to be looking at digital strategies for learning and teaching. So please hang around for that one. We've also got some things we've always had. We've got a virtual hall where you can meet the publishers. I know many of you enjoy interacting with the publishers and looking at all of the materials that are available there. So we've got an opportunity for you to do that in the virtual hall. We've also got a very exciting online library. So please go and have a look at that. So just really from me to finish, a huge welcome to all of you. Thank you for helping us grow by your side. I hope today is about a little bit of professional growth and development for all of you and for us too. It's always a pleasure to work alongside these. A very quick thank you from me to the team who put this together, especially to Ali in Madrid and to Michael in Palma, but also all those others that work behind the scenes, the presenters, but mostly all of you. So welcome and please enjoy.
Hi, good morning everybody, and welcome to this session, which is an introduction to some of the principles behind acceptance and commitment therapy, and how that might be helpful for those of you working in teaching environments, how its application to training and coaching and even bibliotherapy can be really helpful for teachers and educational staff working in stressful environments in frankly, quite stressful times. Before I start my presentation, I just want to say that I'm joined behind the scenes by my excellent colleagues Michael Leahy, who's in Palma, and Anne Lennon, who's in Bilbao. And they'll be giving some technical and moral support through this presentation. We had a couple of technical hitches earlier, which we didn't have in our rehearsal yesterday. So if you suddenly hear a disembodied voice, it might be Anne or Michael telling me that I'm not visible or something similar. So please bear with us, we'll do our best. But I think as everybody knows now, we're all at home in different contexts and things sometimes go wrong. Okay, so I'm now going to share my screen. Hopefully, let's see. Okay, I'm going to share my screen and start my presentation. Okay, so my name is Fiona Mitchell, and as you'll know from my bio, I have a background in teaching English and broader educational leadership. But I'm also a certified coach, and I'm currently on a master's programme on coaching and behavioural change. One area that I'm particularly interested in is the area of mental health and the grey area in particular between coaching and therapy and training and the application of psychotherapeutic models to the training, the workplace training and workplace coaching environments. However, I do want to emphasise that today I'm not proposing that everybody goes away and practices ACT therapy, but simply I'm drawing on, I'm hoping to present some of the principles underlying acceptance and commitment therapy, and sort of drawing on that model in terms of how it can work the training and workplace coaching. And there's a lot of research on that, which I'll talk about as we go through the session. So in the short time I have today, I'll be presenting the model. It's a very dense model, so I'm going to have to really fly through some elements of it. And it's adaptable, as I say, for training. And it's shown, the research shows it to be effective for a broad range of issues, and many of which are common to all of us, including stress, anxiety, fear, worry, burnout, depression. The list is actually impossible to go into. It's virtually endless. I mean, there are so many case studies, and I'll mention that later. But I think that in the current context, and just to pick up on what Mark Howard just said, around future and future proofing and what's going on at the moment, well-being has really become front of mind for many people. And when we talk about mental health, I'm using that term really broadly, not in terms of pigeonholing people, but in terms of us all at times having issues with our mental health. You know, we have good times and we have bad times, and that's really come to the fore in the current context. So I'm going to move on, and just quick overview of today's session. So here are the points that I hope to cover. I'm going to attempt also to put in some really short, I mean, you know, very, very short hands-on activities that you can participate from home if you like, just to give you a feel of also the very practical and pragmatic nature of ACT and how it works. But we'll start with a flying sort of theoretical overview and its relevance in particular to working environments in schools and educational contexts. I'll draw on a couple of case studies. I won't dwell on them, but I'll touch on a couple of case studies. And I also hope that you'll leave the session with some ideas about how to learn more about this for yourselves if you find that you're interested. Okay. So context, and why am I talking about ACT today? Oh, and I forgot to say at the beginning, acceptance and commitment therapy is known as and pronounced ACT. Okay, so that's why I keep talking. From now on, I'll be referring to ACT. Okay. So if you look at the slide that's on the screen now, I think that quote, which I've actually drawn from a journal on behaviour therapies, so it's sort of related to my area, but I think that most of you working in schools or educational contexts now will agree that I could have drawn that from 1,000 sources. Okay, fairly consensual that teachers and education workers work in a very stressful environment. Okay, now the other thing that I want to point out is if you look at the data on that, which again, it's a fairly random quote. It's from 2012, which is way before COVID. So, I'm sure it's no secret how COVID is thought to have affected our mental health in general, I think, as populations. But if we had that quote when we were talking about teaching in relatively, and I use the word normal context, I'm sure you can imagine the implications for the current context, and that's something that we're going to look at in the second half of the presentation. Okay, so what is ACT, acceptance and commitment therapy, as I say? Well, here's some information. So ACT came into being at the end of the 90s, led by a renowned clinical psychologist called Dr. Stephen Hayes. It evolves from a theoretical framework known as relational frame theory, and we don't really have time to go into that today, but some key principles to hold in our minds as we're going through the presentation, which will help you make the connections, are that one of the key sort of principles underlying relational frame therapy is that our minds are kind of non-stop language machines, and sometimes we get trapped by our own language. And this is based on the relationships that we form between, as we go through our lives. We're constantly relating one thing to another. That's how we work. Everything is in relation to something else. Now, of course, these relationships that we build up in our heads can be incredibly useful for us. In fact, they're largely responsible for how we survive. But sometimes they can be problematic, and sometimes we can get stuck with frames which we consider to be true, but which in fact are just thoughts. So to give an example, a non-arbitrary thought or relation is that, for example, this football is bigger than this grape. Okay, that's non-arbitrary. We can consider it a fact. But what about if I start to say these Armani jeans, which cost £200, are really smart, whereas those £20 jeans that I bought at Asda are really scruffy. Okay, so there's a relation that many of us may actually consider to be true, but that's actually fairly arbitrary, and so that's kind of where relational frame theory goes. It's about how we can mix fact with fiction, and how, when we start to go into more personalised examples, how actually our negative thoughts can be sometimes quite brutal and affect how we live. So if we have an example, which I might take from a coaching or training context, if imagine somebody comes in and they say, I'm a teacher at such and such a school. I've been a teacher for 10 years. Okay, it's all fact. And then they say, but I'm really terrible at classroom management and I just don't have the professional confidence to deal with it. That's not a fact. That's where we start to mix fact and fiction. That's where we start to fuse in ACT. We talk about fusing with our thoughts. And so therefore I become the problem. Okay, I become the problem and I can't escape from the problem because the problem is inside me. So that, very long story short, that's kind of where relational frame theory sits. Now, ACT also diverges from more traditional cognitive behavioural therapies. It's known as one of the third wave of cognitive behavioural therapies. One of the elements here is that ACT is not about changing or eliminating thoughts. And then the really interesting thing is that, and that's kind of what we're talking about today, is that ACT has been shown to make an effective transition from clinical to non-clinical settings, so i.e. into the spheres of workplace training and workplace coaching and other forms of coaching, in fact. Okay, so why am I interested in this model of therapy, coaching and training? Okay, well, one thing is that it's based on research. Okay, it's based on evidence, and the evidence suggests effective outcomes. since the late 90s, there have been around 300 randomized control trials on ACT and its effectiveness compared to other cognitive behavioural therapies. So, you know, this is not touchy-feely stuff. This is based on research, and for me, that's really important. Another thing is that it's very inclusive, it's non-judgmental, it's compassion-based. In ACT, we're not, sort of an ACT-based approach is not interested in things being right or wrong, in thoughts being good thoughts or bad thoughts. It's more about the principle of workability. You know, is this working for you? It's transdiagnostic. The whole point of ACT is that it's transdiagnostic, and that's what makes it's been used across a wide range of contexts, and that's what also makes it very relevant in other making the shift from clinical to non-clinical. So whereas it is used for generally accepted, you know, clinical conditions such as psychosis, it's used for addiction to substances, it can be used for pain management, it can be used for dealing with medical conditions, you know, such as migraine or tinnitus. It can be used on patients themselves, it can be used on parents of children who have illnesses, it can be used with carers, it's been used with prisoners. I mean, there's such a range, and that's what makes it particularly useful when we talk about adapting it to the workplace, and looking particularly at those areas of stress, burnout, anxiety, frustration. It's also workable across cultures and different contexts because it's values based, and we'll look at that a bit later on as well. Just to say that sometimes workplace training and coaching, you know, some people would say it comes from quite a Western corporate sort of viewpoint, whereas this, as I say, it's based on individual personal values, and so that makes it very flexible, very malleable, very adaptable. It's transparent, it's pragmatic because it's based on a theory of human behaviour, and if you like it, you know, it's really hands-on, activity-based. There's lots of material out there. You know, I've worked through as part of my training loads of ACT on myself, and for example, every Tuesday evening I meet up virtually with a group of you know, other practitioners, and we talk about new things coming out, new training courses, cases, and so on. So it's a very kind of inclusive and has a friendly sort of professional context around it. So ACT is, that said, ACT is pretty complex, and sometimes that's used as one of its detractors. So it has many processes, it has endless activities, it's non-linear, and I was wondering if this presentation might be a bit non-linear, so we'll see how you feel by the end of it. But here are some sort of central boiled down ideas, okay? So the basic premise with ACT is that life is not always happy, that life can be tough, and that all of us suffer and experience at some point painful, unwanted thoughts and feelings. So inner events, we might call them, or private events. And sometimes that's fine. Sometimes it doesn't impact how we live our lives, but sometimes, or at times, it does. So ACT moves away, as I said earlier, from the more traditional therapy and coaching practices around changing or eliminating or avoiding thoughts. So, you know, just trying to put a lid on things and forget or distract yourself. ACT principles would say that that's counterproductive, okay? Here it's more around changing the relationship with the thoughts that you don't want to have, changing the relationship and setting out the direction. So ACT is much more about direction than destination to help you sort of live the life that you want to lead, okay? So I'm going to give you a really quick example of that, which is simply that if I ask everybody, and it's such a shame I can't see you, and I don't know how many of you are out there, but wherever you are now sitting, I just want you all, just for a minute, to close your eyes, and whatever you do, I want you not to think of a pink elephant. Just do not think of a pink elephant or anything that looks anything like a pink elephant. Okay, you can open your eyes, and hopefully I've made a point there, because I'm imagining all of you have some kind of vision of a pink elephant floating around. Probably now your eyes are open, you're still kind of imagining this pink elephant, okay? And that's kind of where ACT is at. In fact, emotional goals, when we talk about ACT acceptance and commitment coaching or therapy, emotional goals, things like, oh, I just want to feel better, or I just want to feel I just want to feel better about myself, are not actually in scope, as they tend to reinforce the agenda of avoidance. And the agenda with ACT is not avoidance, it's acceptance. And it's actually about developing the skill in particular of psychological flexibility, which helps people live with more ease. Okay, so we're going to go and look at that in a minute. But now, my next slide, I'm going to call on my colleague Michael to help me, because we're going to watch a 2-minute video by one of the masters in bringing ACT to life. This is Dr. Russ Harris, a couple of his books on the screen, which I'll say more about later. But I just want you to watch this short, it's 2-minute YouTube video. So to do that, I think I have to stop sharing my screen for a minute, if I remember rightly. So I'm going to end the show. I'm going to stop sharing my screen. I think this was right. and I'm going to see if Michael can play that video.
What's the most important thing in life? A lot of people, when first asked this question, answer happiness. But did you know there's a large and growing body of scientific research that shows the harder you try to control the way you feel, the more miserable you are likely to become? Yes, that's right. When we push away unpleasant feelings, there's a rebound effect. The harder we push them away, the harder they bounce back. We see this very commonly in anxiety disorders. The more you try to get rid of anxiety, the worse it actually gets. Many of the things we try to get rid of unwanted feelings and make ourselves feel a bit better, such as drugs, alcohol, cigarettes, junk food, buying stuff we really don't need, and distracting ourselves in a zillion different ways, actually tend to make life worse in the long term. In order to avoid uncomfortable feelings, we often avoid the people, places, situations, and activities that give rise to them. And the more we do this, the smaller our lives get and the more opportunities we miss. As you follow this program, there's a high chance your happiness levels will increase. But that won't happen through trying to control your feelings, through trying to get rid of the unpleasant ones and replace them with the ones that feel good. It will happen as a side effect of actively building a rich and meaningful life. To quote the American author Nathaniel Hawthorne, happiness is a butterfly, which, when pursued, is always just beyond your grasp, but which, if you will sit down quietly, may come and alight on you.
Okay. So now, Michael, if you stop sharing, and I will share my screen again. Okay. Let's see if I can. I'll just go to, okay. Can you can see, okay, good. Okay, Michael's saying yes. So that was a better summary than I could have ever given, of course. And I'll just quickly say about the two books on the screen. The book that's on the right, The Happiness Trap, is a great read for anyone who's interested in this, and that book's written for everyone. You can see the title, Stop Struggling, Start Living. The book which is on the left is a primer for ACT practitioners, so it's a slightly different book, maybe not for everybody, but certainly if you wanted to start doing some reading around this, The Happiness Trap is where to start. And I've got information on resources at the end of the presentation. Okay, so just to build on what we've already said and what you've just seen in that video, let's start here. Let's do a very short real-time exercise. Again, it's super quick, going to be less than 2 minutes. And if you look at the picture there on the right, that's me. Okay, that's me there behind my hand. So I'm now going to invite you all, again, it's such a shame I can't see you, but let's see how this goes. I want you all to just look up wherever you are, just look up and look around you and take in the world around you, okay? And you could focus on different senses, not necessarily your vision, okay, whichever is your strongest sense. I'm using vision here for the purposes of this demonstration, which is a kind of metaphor for how ACT works. So imagine that what you can see or hear or smell around you represents everything that's important to you in your life, okay? Then open your hands, okay? So I'm just going to do it with one hand, okay? But you, well, do it like this with both hands. And slowly raise them in front of you, okay? Just slowly, slowly, slowly towards your face until they're right in front of your eyes. And you can actually only glimpse the world through your fingers. And notice how that affects your view of the world. Different, hey? It's different from that world that you had out there before you just a few seconds ago. So what would it be like going around all day like this, or going around at those particular moments where your anxiety arises? How much would you miss out on? How much would it limit your ability to respond to and to connect with the real world and the real people around you? So in ACT, we talk about getting hooked and missing out on life and not acting effectively because we can get clouded by our thoughts. So now slowly lower your hands. Do this really, really slowly. Just lower them. And as you increase the distance, notice how much easier it is to connect again, to connect with the world around you. How much more information can you take in? How much more connected are you? And so, but your hands are still there, right? I mean, they're still there. They haven't gone away. You know, I could sit on them. You could sit on them for a while if you wanted, but you know, you'd end up having to not sit on them. And so this is a metaphor that we often refer to as hands as thoughts, and there are well, literally tens, possibly hundreds of metaphors in ACT. But this process we call diffusion, okay? Diffusing from our thoughts, that thoughts are thoughts, they're not truths. And this is, at the heart of this is where we have psychological flexibility, which is the skill which can really help you start to, let's say, decloud your mind from the negative, the sort of internal chatter that's going on and maybe making you sometimes feel anxious or stressed or worried or that you can't cope. So if you have a look now at the left side of the slide, and I've just drawn here on a real case. So if you have a person, okay, then this is a very straightforward example of what is not necessarily a short process. But so somebody quite common, social anxiety, in this case performance anxiety. I can't do presentation in public because it makes me nervous and anxious. Can you see it? It's a truth. I can't do a presentation because it makes me nervous and anxious. There's the fusion, okay? There's the kind of rigid, psychological rigidity, if we would call that. But through a process, the person now says, well, okay, now I can do a presentation in public, it's great, but it makes me nervous and anxious. It's a much better place to be in because I'm not doing things that I want to do, but I'm still conditioning myself there with that word but, okay, so I can do it, great, huge progress, but it makes me anxious and nervous. But then we come along to this really ideal stage, according to acceptance and commitment coaching, But this is where you say, well, I can do a presentation in public and it makes me nervous and anxious. Okay, so I can do both. I can do the presentation and I can kind of just sit back and accept that it makes me nervous and anxious, but it's not interfering me, it's not clouding my thoughts. And then what sometimes quite often happens then, and in this case, we have, if I keep doing presentations in public, actually I start to feel other benefits, I start to focus on other things, I start to meet people, I start to network. And hey, you know, I was actually invited to repeat my presentation in another conference, and that makes me feel really good. And now I feel I'm making the professional progress that I want to make. And actually, the nerves and anxiety start to fade into a secondary plane. Okay, so things can start to happen as a result of developing the skill of psychological flexibility and diffusion, but that's kind of collateral, actually. Okay, so that's where we are on the journey now. Okay, so just I'm just conscious of time. I shall rush through this. Okay, we have some core therapeutic processes in ACT, and the ones that we'll be focusing on mostly today are the ones that I've highlighted there in pink. So values, committed action, and acceptance. We've already touched on diffusion, actually. Present moment awareness underlying all of it. You know, present moment awareness is similar to mindfulness. There can be a slightly different approach sometimes in ACT, but yeah, living in the present. And I noticed that the country directors earlier talked about living the present, living the now, so all very relevant. And if you look at the diamond, that was called the ACT hexaflex on the right hand side of the screen, again you can see how the therapeutic processes are mapped onto the psychopathological processes, and with psychological flexibility there in the middle. Okay, so there's just a graphic, but aware of time, I'm going to try and get onto the stuff which may feel more relevant. Okay, so a couple of things in ACT. Values, personal values, and being able to articulate your personal values is pretty fundamental. As one of my tutors said, the question isn't what's the matter, the question is what matters, because that helps you to bypass all sorts of things, sort of things and thoughts which may be holding you back. Values are personally chosen, they're personally meaningful, and just be aware that values are not necessarily the same as morals or ethics, because morals tend to be socially constructed and they tend to sit slightly outside of ourselves, and it may well be that we then assimilate the morals of the country or the culture or the context that we've been brought up in. But when we talk about values in ACT, these can be really granular, really sort of micro, absolutely individualized values. And as I said earlier, I think I mentioned that we focus very much in ACT on direction rather than destination. Okay, so focusing on your values and understanding your values can be a strong motivator to help you to overcome some of your challenges, some of that mental chatter, some of that, the stuff going on which is upsetting you and making you somehow not think that you're, making as much as you could of your life, or getting you down. And there are lots of tools to do this. So there are some validated and well-respected questionnaires, a couple of which you can see on the screen from the valuecentre.org. And there are also some really quite manual activities, like a guy called Rich Blonner has an activity called sorting the mail, where you literally, and I've done it this way, I found it fascinating, you literally write down what each value means to you, and you actually write it down in a notebook, quite a long process. But we talk about values a lot in all our, in the institutions we work in, and your school will have values, as an educator you have values. But it's actually, until you get really granular with values, it can be surprising how you don't really understand some aspects of yourself, or how suddenly things become clear and how many things are in fact related to your personal values. Acceptance techniques as well, also absolutely key, and here's one of Harris's amazing smorgasbords of acceptance techniques, which I wanted to share with you, and metaphors. But the acceptance techniques, and again, this is the whole, this underlying element of ACT, is that everything is personal and individual, and there is no end. I have my own acceptance technique, which is probably, well, I don't know whether it would ever be in a textbook. It might be, it might coincide with something that something else is just an association that somebody has made. But for training session purposes, so let's just get back onto this idea of training or group work or working with a group of colleagues or friends, where there are rules of safety, and of course I'm always talking about these types of discussion always with rules of safety and confidentiality, discussing some of these techniques, what works for you, what can help you, what you found useful, can lead to some really great conversations about self-care, which can in turn support others. Okay, so one of these ideas, the choice to feel, I don't know if you can see it on the screen there towards the bottom, is around, and it's a key question in ACT. Okay, you can either never have this feeling again, but if you don't have this feeling, it means you'll never love, or you'll never care, you'll never feel any joy. Or you can accept this feeling, and at the same time, you will at other times feel love, care, joy. Okay, so that's the kind of feel that it has. Moving rapidly on, because I do want to leave at least 10 minutes for questions. So, and now bringing the focus really back into the educational context and environment and you. So ACT is effective, okay, for common mental health difficulties. That's a fact. And there's also evidence that it can bring about secondary benefits in terms of life satisfaction, okay, that kind of collateral. The adaptation of ACT for non-clinical contexts shows really positive indicators for challenges related to mental health, such as stress, anxiety, or depression. In particular, the development of the skill of psychological flexibility and the development of understanding your values and values-based living helps reduce the likelihood of emotion-related exhaustion. It helps people feel more in control of their jobs. And it seems to be that it means that you can, because you focus less on exhaustion, you focus less on trying to avoid your negative thoughts. It means you can use your resource or your energy to find new opportunities, to innovate, to develop, and to feel more in control. Now I just have a sign saying that I've got bad network, but can everybody hear me? Yeah, okay. So I've tried to illustrate that in this graphic here. So how psychological flexibility works. High psychological flexibility means that you're less likely to use your energy trying to avoid or control or put the lid on, as you saw in that video earlier, which means that you're more able to notice, respond, connect with, take action. So therefore you feel more empowered, you notice things, you're open to things, you're connected with the world around you, and you're able to change those frames that you might be holding in your mind, that we all hold in our minds. The first thing about this is that we're all, we're all the same, essentially, in this respect. Okay, so why am I exploring then ACT training for teachers? Well, as we started the presentation, teaching is well recognised as a high stress profession, fairly consensual, and I'm not one for comparing professions here, and I prefer not to judge what makes one profession more stressful than another, and then there's a whole individual context and factors around that. So I'm not trying to comment in that respect. However, as with frontline and caring professions, teaching often involves quite an amount of what's called emotional labour. Okay, so this means that really, however you're thinking, so if we think in the current context, and many of you will have recently gone back into your schools and into classrooms, And apart from your teaching load or your teaching responsibilities or duties, you're also now thinking about, you know, are the children or students in my class socially distancing properly? Did they all you know, wash their hands with gel when they walked into the room? And actually, you know, how can I control all of this? And maybe at home, you know, you may be worried because as you left home this morning, somebody in your family didn't feel very well, or another colleague doesn't feel very well, and actually your own children are in another school, and are they taking things as seriously as you are? So you may be worried about, you know, what your future holds. You may be, you know, you may have somebody close to you who's recently lost their job due to this. So you've got all of that going on in your head, but at the same time, there you are in front of your class, in front of the children, in front of your adolescents or whatever, and you're using a strategy called surface acting, okay, which is that you are there carrying on and teaching with all of that additional noise in your head, okay. So surface acting and continual surface act. So I'm not talking about if I have to do this for a day or two. This is fairly continual, right? You're all working Monday to Fridays. So surface acting is associated with reduced levels of well-being and increased likelihood of burnout in some people. But the really interesting thing is that people with greater psychological flexibility seem to be less affected by that. And the evidence suggests that instead of trying to control or suppress your feelings, they just let them in, okay? Accommodate them, accept them, go with them, roll with them, breathe, you know, open up to them. And you can kind of see the gesture I'm making myself as I talk about that. And that seems to be key to freeing up the internal resource and energy to focus on the present, focus on you know, the present task, notice things, carry on connecting with people, see opportunities, and carry on living your values-based life, okay? And that helps promote self-care, and it helps to reduce stress, okay? So just, yeah, I think I've just about got time to run through. So again, this is drawn from a real example, okay? So feeling anxious and stressed in current situation, seeing this self-defeating pattern of behaviour in myself. When the feelings build up, I close down, and this is when I'm at work, it's not just when I'm at home, this is when I'm at work and I'm in a teaching environment, I close down, I can become impatient, I can even become angry. However, okay, and this is a process, okay, this is through a process of coaching. Now I start to see that when I act like this, I feel even worse about myself because I start to treat other people in a way that goes against my own personal values, which I've already said are around kindness, respect, openness, positive living, okay? So then I can learn to develop this present moment awareness to recognise when I'm getting hooked, start to notice what it's like, what's the trigger, what do I feel like, I get really curious about it. And then I can make a choice, which a lot of people don't realise. I can make a choice to commit to the actions which take me towards the life I want to lead or the type of person I want to be. So I have a choice. I can either avoid my discomfort by closing down, say, leave me alone, just go away, stop bothering me. Or I can use my own chosen techniques to hold, to accept my feelings and behave consistently, okay? And in act-based coaching or training, we might use a tool like this called a choice point, okay? So I've just mapped that summary is based on this choice point, which did belong to a person. And again, it looks really simple and straightforward. It's actually built up over a series of sessions, okay? But if you have a quick look, it's like a bird's eye view, and it has quite a lot of useful detail and quite a lot of underlay to it, okay, and accompanying bits and pieces. But look about the direction of living. So the choice is where I'm swamped. If you look at the bottom of the screen, I'm swamped by my anxious thoughts and feelings. But I know that the way I want to go, I want to be, there are my values, there are my beliefs. I believe in education. I want to be a role model, actually. I'm the kind of person, I love having fun with my friends. and these experiences help me grow. But when now we look to the left, when I close down, when I fall into all of those behaviours, I actually feel like my world's getting smaller. Like I'm closing myself down. This is not me. It's no fun, and it affects other people. And there at the bottom on the right, you have acceptance techniques associated with this particular person. Okay, and a lot of which is just remembering that, you know, I'm human, and that I don't have to like the way I feel all the time, but I don't have to like these feelings, but I don't need to run away from them or close down or start lashing out at other people. So there's a thought there. Okay, we will probably won't look at this as another example of an exercise about dissecting the problem. And again, you know, wealth of resources there. This might be a starting point in training sessions or so on. And I will invite anybody at the end who, because I'm rushing through these last slides, anyone who wants to contact me, and you know, please do. I'll put my email address up there. So if you're curious about this, there are loads of resources out there. So whether you're interested in this for your own purposes, if you're looking at inset training, that book in the middle, actually, Applying ACT to Workplace Coaching and Training by Rachel Collis, is very, very focused on the workplace. There are internet resources, so Auntie ACT, which is the Act with Compassion website, has lots of resources, worksheets, mostly aimed at therapists. There are Facebook groups, there's a whole range of very short YouTube videos like the one we saw earlier, which illustrate the different principles of ACT. So there's a wealth of resources out there. And just a few thoughts about getting started. If you're interested, maybe looking into this a bit more either for your school or for a group of friends or for a kind of, you know, a support network. There are all sorts of possibilities. Well, there are some ideas. So, you know, find out if anyone's interested, find out more, do some of the reading, explore I think ACT more than many models I've seen, there is loads of work out there. Be mindful that it's non-linear, and remember that ACT is not about making problems disappear. It's about helping you live a fulfilled, meaningful, purposeful life, and it's about easing your emotional burden. And we all have emotional burdens. If you like the model, be playful and open-minded. You know, there are as many functional metaphors as individuals. And also remember that ACT will not be for everyone. It's something that you can really only do in confidence with people. So that's when I talk about rules of safety, a safe environment. If you are doing this in a group, not everybody wants to, you know, talk about their particular emotional issue. So it's not for everyone, or it's certainly not for everyone as a group type of therapy. But the bibliotherapy, again, the books which are out there can be really helpful. So, and I've got some on my slides here. I've got some work, sort of more to do with the workplace as opposed to the therapy itself. So I would just like to thank you, because I think it's 10 minutes before the hour, so we only have 10 minutes left. I want to thank you for joining me today, and I know my colleague Anne has been collecting questions. I know it's a huge topic, so it would be great if there were some questions coming through now, which I could hopefully answer or at least touch on live. And if not, if there's anything else that I've gone through too quickly, then, you know, obviously my email address is up there. So Anne.
Hi everybody, and hi Fiona. So there's quite a lot of really interesting questions, and probably, as you say, we're not going to get through all of them, but I think you said that, you know, if we don't answer questions, you'll be able to look later at the Q&A and, you know, give an answer. There are questions about relationships with people in our work context, and particularly, so one person has asked about how can, you know, ACT, how can we deal with sometimes difficult relationships we have with colleagues, you know, dealing with sometimes the sort of hidden messages that they're sending us in a work context. And as teachers, there's also a question about our relationships with students. You know, are we getting more distant? And that was one question. And also, how can we manage or help students manage their frustration especially after failing again and again. So, you know, lots of sort of as a teacher at work.
Well, they're all great questions. Let's start with the relationship. So the first question with relationships as regards colleagues, I understand. Yeah,
that's right.
Yeah, and I think that's where, well, there are, it's kind of difficult to know where to start on this one. So sometimes bad relationships form, and I guess we're talking about, I think you used the word difficult, Anne. I don't think I've put that word.
It's sort of like more difficult relationships with some colleagues. Yeah.
So sometimes difficult relationships form because, and it goes back to this idea about things that we think inside our head that we think are true. So sometimes, so again, I'm not going to give any sort of this is the right answer, but some things that happen are, which may be useful to reflect on, that sometimes relationships are difficult because we think that somebody is either thinking something about us or doing something deliberately to make things difficult, or we don't think someone's being transparent. Those things could be true, but they may not be at all true. Okay, so there's one key thing there, which is round. Now, if we were in an acceptance and commitment coaching session with a person who had this issue, for example, there would be a lot of work that we can do around there in any case, around why we're saying something, or why we're thinking that somebody may be doing something which is deliberately to affect us. Now, the other really interesting thing there is around values. Articulating and really understanding your own values. So often problems with relationships are related to values. Now, having different values doesn't make one person good and one person bad necessarily. Okay, mm-hmm. The personal values may just be different, and that means, and I'll give a very superficial example, which I'm just kind of inventing off the top of my head. Let's say that I have a colleague who irritates me because they're always asking me for things that I've already done, like work that I've already done, let's say.
Yeah.
Or it may even be a senior colleague, and I kind of, well, why doesn't he do it? He's the senior one, or she's the senior one. Okay. Now, ultimately that may be a question of values. It may be that I value working really hard on anything which is, which comes to me, it's assigned to me. I believe that the correct way to operate, my value is around putting the hard work into something that I'm asked to do. Maybe the other person actually doesn't have that value. It may be that they think that, it's better to be quick and pragmatic and actually, if the work's already done, to ask somebody for it. So it's a very superficial, off-the-cuff example, but I think it's useful to think about values and how very often, even with the school or the organisation you work for, if you're disaligned, a disconnection is another thing that what's called disconnection is something which ACT is really helpful for, because you can become disconnected from your organisation. You don't really feel aligned to it, which can have a huge impact on your work. But becoming more aware of those of what's going on in your mind can actually help resolve that.
I think I was going to say, Fiona, the word acceptance there keeps coming back through to me in that. So
absolutely.
Very interesting.
And then the other thing is that in terms of acceptance and commitment, I also said towards the beginning of the presentation that it's compassion based. So this is also very much about opening yourself to accept other people as they are, and to, now of course I'm not talking here about I'm not talking about people here who are committing some kind of abuse against a colleague, or I'm talking about sort of everyday difficult tense conversations.
Fiona, I think what I'm just going to suggest in terms of covering questions that I ask you one more. Is that okay? I didn't want to
because we've only got 3 minutes.
No, I mean, I think
question.
Yeah, I think we could be here all morning, couldn't we?
We definitely could be here all morning.
Like, in order
Can I just say one thing though?
Yes.
I mean, a great piece of work to try, and again, I don't know the context that question's come in from. A great piece of work to try always is being curious just focus things as curiosity about why relationships aren't working, and making yourself sounds counterintuitive, but making yourself work with people with whom you don't actually have a great relationship. You can probably learn more about yourself and the other person like that. With that direct contact, that can be a really helpful way to work. But obviously, I can't sit here and judge different working contexts.
I do have. I'm not sure whether we will have time, but Eleanor from Palma has asked about would you say that frames, as you've described them, are similar to limiting beliefs?
They are associations, so they can definitely be, yes. A frame can definitely limit you. So if you have a frame in your mind, which is an association, so associating ideas. If I have a frame in my mind that says, I don't know, that teacher I had at school 20 years ago, or a bit more than 20 years ago actually, was right, I'm rubbish at this, then I'm limiting myself or I don't have the professional confidence to actually apply for this new role in my school that I'm interested in, because I'm not going to get it. As soon as you start saying things like I'm not going to get something, or this isn't going to work, or I'm the only person who feels like this, you're fused with your thoughts. So they definitely limit you, and they limit you because they limit you in a way that means that you deny yourself access to real world experience, which would start to unchain that belief that you have. Because actually the more exposed you are to real experience, the more you'd say, well, no, actually that's not true. Look at the chap with the presentations. Then his whole professional world starts to open up.
I hate to interrupt you, I really do, because I think it's so interesting, and we could stay here, as I say. And you have committed to looking through the chat and giving answers where you can. So thank you so much for that, and thank you so much for such an interesting. Everyone has found it so interesting. Just before we leave, Fiona, and we all go off to another session. I'd like to remind you all that you've got the virtual hall. I've just put the link in the chat, and please visit the virtual hall. I think you'll find it really interesting to look around there and see what, see who's come to see you today. And also, Mark talked about we're trying to encourage you to share teaching tips for our 80 years celebration. So can you send your entries in 80 words or less or more to the address there, which we'll also put into the chat. So thank you so much, Fiona.
Thank you, everybody, and please contact me. I'm sorry, time, but thanks, and any questions, I'll get back to you. Thank you.
So
bye.
We'll end the session, and we'll be we will announce. We will go back to the Q&A for you.
Great.
Goodbye,
Thanks,
Fiona.
Thanks, Michael and Anne. Thank you. Bye-bye.